neuro-oncologist who gives people chemotherapy, it's very helpful working with the neurosurgeons as well, because they become a very important part of the teams. They're very important at the initial diagnosis of the patient, but then also continuing throughout the care of the patient as well. Our work intersects both in terms of patient care as well as in research, because there's a lot of back and forth over patient management and decisions on how to take care of patients between the neurosurgeon and the neuro-oncologist. Brain cancer, more than can be expected, is often a surgical disease, and surgery plays a very important role in brain cancer. And so Dr. Curry is a very important first step in managing patients. And then I pick up after he's done his surgery, but oftentimes I will go back to him and say, well, let's say, do we need to do another surgery on this patient? And so there's a lot of good back and forth between managing patients throughout their entire care.
As a surgeon, I look to the neuro-oncologist to help me determine which patients should have surgery, how aggressive we should be, should we do reoperations. There is tremendous overlap in our clinical work and also in our research or investigative work. So a huge percentage of our patients that are treated at our Brain Tumor Center are also involved in some way in research on brain tumors, whether it be by participating in a clinical trial treatment or just giving a tissue sample or a blood sample to help various laboratories or studies go forwards. Dr. Gerstner is particularly innovative and on the cutting edge with advanced imaging, which help us try to interpret findings in MRIs to look at the impacts of our treatment.
And I think we have a particular interest in working together on immunotherapy and imaging of immunotherapy and trying to figure out better ways of treating patients and figuring out novel tools that we can better improve the care of patients with brain tumors. So Dr. Curry does an excellent job in running clinical trials with immunotherapy, and me as a person who is interested in figuring out new ways of studying the brain from an imaging perspective, it's a nice collaboration together that I can partner with his clinical trials, introduce some of the new tools that we have from the imaging world, from MRI scans or PET scans, and really help him better understand how his drugs are working in individual patients as they go through treatment.
Believe it or not, it's one of the hardest things when you're looking at the MRI or the normal scan of a patient that has a brain tumor is interpreting what exactly is going on. It's easy before you do anything, before you touch it, at the time of initial diagnosis, to say that's a brain tumor and to try to guess what kind it is. We have to verify that. But once you do surgery or once you treat with radiation and chemotherapy, or in particular immunotherapy, it's really hard to know what is going on in that tumor and what we call its microenvironment. And we need specialized monitoring and specialized techniques to be developed to be able to say, is that growing tumor or is that inflammation? Is that dead tissue? What exactly, is that scar tissue? What exactly is going on? And many times we just don't know and we play a hunch, or we have to resort to biopsy, a surgical procedure, to try to get to the answer.